Hello everyone, in today's video we will talk about medio-lateral projection in mammography. Why is this projection required? It is essential for triangulating a lesion during workup in recalls as part of the screening program, for checking for any migration of a clip already positioned on a lesion. Also, it allows for better visualization of the retro-areolar area. As regards the study of lesions in the inner quadrant, a lateral medial projection is to be performed. How does a medio-lateral view appear on a mammogram? The first thing to check when evaluating the quality of the image produced is the position of the glandular body, which must be perfectly lateral. That is to say, the median axial plane, passing through the nipple, must be perpendicular to the chest wall. The pectoralis muscle is barely visible and straight. In this case, as you see, there is a slight error. The width is greater at the top, which should not be the case, but for the purpose of triangulation, the projection is absolutely sufficient. Documentation of the retro-areolar area. That is why the nipple must always be in profile. The IMF must be very well represented. Here, as you can see, there is a fold, but it does not affect the examination, at least not in this case. Compared to the oblique projection, there is a lack of posterior tissue, and therefore the retromammary space is not well represented. I show you this case, a lateral view, the first image an oblique view, in the second taken on the same person. Not only does this small finding look different in the two projections, but it is also a different location. This is to remind you what it means to triangulate a lesion, for which you need superior-inferior information obtained from the lateral projection. For more information on this topic, please refer to the series on triangulation on this channel. Let's move on to positioning. The tube is at 90 degrees for medio-lateral view. See the example in the picture for a right medio-lateral projection. Place the patient in front of the unit. Choose the height of the detector, which is equal to the upper profile of the head of the humerus. I'll show some pictures in a minute. The position of the torso is fundamental. Median sagittal plane exactly parallel to the detector, and nipple in profile. Here you can see from above the sagittal plane parallel to the detector and perpendicular to the rib cage. The arm should be placed on the detector with the superior inner angle in the armpit. This excludes documentation of the latissimus dorsi. Note the position of the chest, which is very close to the detector. The radiographer then moves in front of the patient. The hips must be pushed well forward to document the inframammary fold and prevent the breast, or better, the gland, from acquiring obliquity. Here are some positioning errors. Arm and shoulder well positioned in the first picture, but as you see, the chest here is away from the detector. This results in loss of lower tissue and in an oblique gland. In the other picture, the breast appears to be well positioned with respect to the detector, but the arm and shoulder are too far forward, MLO style, resulting in loss of part of the lower tissue and in an oblique gland again. Same mistakes on the images. This one looks like an excellent medio-lateral projection, right? In reality, the triangulation here would be wrong. The glandular body is not perpendicular to the chest wall. The patient is leaning forward with the upper part of the chest, proven also by the fan-shaped muscle. The hips must be brought forward to achieve this. The findings shown here in a true lateral would shift anteriorly and inferiorly, like that. Another very common error artifact in the IMF and in posterior inferior quadrant, especially in very heavy and ptotic breast. It is certainly very difficult, but it's necessary to push the breast upwards very well in order to satisfy the most important quality criterion, the position of the gland. How do you distinguish a medio-lateral from a medio-lateral oblique projection? It is not only the position of the glandular body. As you can see in case 1, gland shows a very good laterality with respect to the chest wall, but the muscle is typical of an oblique projection. And it is not even the presence of a not wide pectoralis muscle, as you can see in case 2. Here, the breast is sagging. And this disqualifies the image as both medio-lateral and oblique projection. Both criteria must be met: laterality of the gland and a straight shape of the pectoralis muscle. Well, I hope this has been useful to you. Best regards, and thank you for your appreciation of my book and of this channel. See you!